So cost of dental implants. This has got to be the number one question. So what determines cost?
There are a ton of factors that go into cost of the case. So one would be the type of implant, right? Is it a regular implant, a long implant? Does it go into the cheekbone? Does it go back in the back area? How many are you placing in the case? Is it from USA? Is it from China? Right? Who's manufacturing it?
Okay.
Right?
Are some FDA approved and some are not?
Yeah, this even goes in the grading in terms of the titanium, through 1 through 4 in terms of the medical grading.
Okay.
All right. All these things go into the cost of the case itself. Another is the type of material that we're using. It could be acrylic. It could be 3D printed.
Like what you're making the teeth out of?
Yeah, the teeth out of.
Okay.
Yep. The teeth could be acrylic, like denture teeth, right? It could be 3D printed material. It could be milled from a machine. It could be ceramic. It could be zirconia, which is like an artificial diamond now.
Is that what you use?
Yes.
Like zirconia? Is that strong?
Now.
That's the strongest one?
That is by far the strongest and best looking material that there is.
Okay.
Correct.
I interrupted. What else is a factor?
You also go with the complexity of the case, right? How much bone are you missing? Are you missing the width of the bone, the height of the bone? How much bone grafting do you need? Do you need a block graft? Do you need sinus lifts, right? There's a million different procedures that go into this.
Okay, and different types. So what about sedation?
Sedation, that also changes cost quite significantly. So if you want to just be awake for the procedure, which we never recommend, right? But that might be advertised by someone else. You could do oral sedation, IV sedation. IV sedation would be the best. It is a little bit more expensive, but it is also the most safe.
Okay,
Yeah.
okay.
That is what is one of my pet peeves about this whole process is no one really breaks down. It's a little bit unfair to be misleading in terms of
Like I see ads on Google, for example.
Yeah.
Like with implants like $9.95 or different things like this.
Yeah.
And we were talking in the green room and you're saying that may be just the cost of that, the actual titanium post.
Yeah, but
So
what
it's
about the tooth
misleading.
on top?
So
What
it's
about the
misleading.
tooth on top?
Do you
or
think
the
it's...
I think it's very misleading because what if you need bone grafting? What if they didn't cover the tooth on top? What if you need a sinus lift, right? So just that advertised price is a very misleading way of doing it.
So if they mislead you in one thing, they may mislead you in other things.
Yeah,
is that your feeling?
What's later down the road, right? What surprise is going to be uncovered?
Because everybody gets their implants for about the same price, right?
No.
Okay.
I actually get my implants at a less cost because I teach, right?
That's right, the Training Institute.
The Training
So you
Institute.
do more, you get discounts.
You do more cases, you do discounts. So that's where we can pass the savings down to the patient.
Are you less than the big guys?
Way less. Yeah.
Really?
Yeah.
Okay, good for you. So the only thing you ask is they come in, get evaluated. Is it a free consultation?
Always a free consultation, right? The biggest thing that people need to know is what to do, right? And once we actually sit down and explain the options of what you can do, what next is actually when is a perfect time to fit it in their lives. And someone may not be ready to do it this year, but you have to come in and be prepared for that conversation later down the road so you can get your finances in order, right? And just be generally just prepared for the case. Because I always tell everyone when they come in, right? I say, if you're not ready to do this case now, I better be the one to do it later for you.
Okay.
Randy, I don't want to forget this part.
Okay.
All right. So when you do see these advertisements, you don't really know what type of teeth they are, right? Are they snap-in teeth or are they permanent teeth? What if they put mini implants in and those mini implants fall out in 4 years?
Is that right?
Yeah.
Okay, so a lot of what I'm seeing when I Google are snap-in teeth.
Majority of them are snap-in teeth. Teeth are removable.
The new guys start with the snap-ins, usually, the new dentist.
The new dentists, actually it's the opposite. The old school dentists usually do.
Okay,
Yep,
okay.
it's usually the older dentists that actually are more comfortable with the snap-in teeth rather than
Is it because it's
the
easier to
permanent teeth.
do?
It's just what the people are used to.
Okay.
Yep, some of the older dentists are used to
So
that.
fixed teeth, upper and lower.
Yes.
And you do it in as little as like 3 appointments, is that true?
Yes,
Like
correct.
you meet them, the next time you do all these measurements, then they get their new teeth.
Yeah, correct. We meet you, figure out what you want, right? Hopefully at that time we're going to be taking records at the same time, which is a lengthy appointment as well because there's a lot of information to get a complete smile makeover completed. And then the next appointment is actually the IV sedation and your smile makeover.
And then they walk out with teeth.
They walk out with permanent teeth, correct?
Is this true like on a denture wear? You can literally walk in the day of the procedure, no teeth, walk out with upper and lower teeth that don't come out.
Yes, correct. But we have to be careful not to be misleading, right? Because there are a very small percentage of people who need a little bit of grafting done at the same time that I do the teeth.
Okay, okay.
So, yep.